So this case is a 71-year-old female patient with no previous relevant medical history. She came to the emergency department 48 hours ago. She had an acute onset of a severe headache. And at the emergency department, she rapidly developed a deep coma. She was then diagnosed in the CT scan of an acute subarachnoid hemorrhage. So now the situation is 24 hours later. She has a moderate respiratory failure due to a bronchoaspirative pneumonia. We are ventilating the patient with conventional lung protective mechanical ventilation. She is in a pressure control mode with a PEEP level of 8 centimeters of water. The driving pressure is 9. The plateau pressure is 17. And we're using a tidal volume of 6 mL per kilogram predicted body weight. And this leads to a quite stable respiratory condition. She has a compliance of 33, 34. And her oxygenation is correct. She has a cell ratio of 99% and a good level of CO2, which is important to maintain during this phase of the disease. So now we are going to apply a lung protective ventilation strategy based on the open lung concept. For this, we will use an automated recruitment tool. It's called the SRM, which stands for Automatic Stepwise Recruitment Maneuver, which is software installed in the ventilator. To access the software, we just press maneuvers. So then we have several options, and we will select the SRM, the sequential recruitment maneuver. This will take us to the main screen where we can adjust the settings, and we have a scheme of the entire process of the recruitment maneuver in its different steps and phases. We have a first incremental phase where we will increase the PEEP level in a stepwise fashion in order to prepare the lung for the actual recruitment maneuver. The recruitment maneuver is here on top. We select the recruitment pressures and the time we will spend at that pressure level. Then immediately after the recruitment maneuver is finished, the system will switch to the next phase, which is the decremental PEEP trial. For this, the ventilator will change to a volume control mode from the pressure control mode that was at the beginning. And during this phase, the PEEP will be stepwise decreased in 2 centimeters of water step. Dynamic compliance will be measured on a breath-by-breath basis, and we will follow the behavior in compliance, looking for the maximum compliance during this decremental PEEP trial. So maximum compliance is the point at which the most dependent part of the lung starts to collapse, and it corresponds to the closing pressure. And with this information, the system can give a recommendation of the optimum PEEP, which will be set 2 centimeters of water above the closing pressure or the point of maximum compliance. If this is recognized by the system, then it immediately will follow to the next step, which is a new recruitment maneuver after switching again to a pressure control ventilation mode. The same type of maneuver will be performed as the first one, and then finally the system will return to the previous settings, but with a new selected level of PEEP that has been identified automatically by the recruitment tool. So next thing we need to do is to set our parameters for the recruitment maneuver. First, we will select the pressure that we will apply during the recruitment maneuver. It's now by default at 40. We will increase to 45 for this particular patient. Next, we will select the level of PEEP, and this will determine the driving pressure that will be used during the recruitment maneuver. And we will maintain a driving pressure of 20, so the PEEP of 25 is correct. Then we will select the rate during the entire recruitment maneuver, and we'll select it to 10 breaths per minute. The next thing we need to select is the magnitude of the PEEP steps during the first incremental phase. We will select steps of 5 centimeters of water, and they will be maintained for 5 breaths, which at this rate means that it will stay 30 seconds at each level. Finally, we need to select the time we want to spend at the maximum recruitment pressures, and this is also related to the rate that we have selected. So 15 breaths means that the recruitment maneuver will last 1.5 minutes. And I think this is a good time for this patient, so we leave it at 15 breaths. The next we need to set is the parameters for the decremental PEEP trial. First is the first level of PEEP that will, with which we will start the decremental PEEP trial of 20 centimeters of water. Then we will select the tidal volume. As during this phase, the ventilator mode will be volume control ventilation, and we'll select it at 5 mL per kilo in order to minimize errors in the determination of compliance, and especially not to underestimate the level of PEEP, or the closing pressure. So 5 mL per kilo is now selected. And finally, we can also select the time we want to spend at each decremental PEEP step, which is also determined by the rate, and we will stay 8 breaths each time. So we can confirm and move to the next safety screen, which gives us 2 important reminders. The first is that we should check once again the hemodynamic status of the patient, because the patient has to be stable in order to proceed with the recruitment maneuver. And the second one is reminding us that we should stay at the bedside during the whole sequence, because we should be there in case adverse events such as a drop in blood pressure occurs during the recruitment maneuver. So then we are ready to start, so we can press the start button after checking the condition of the patient. So we press start, and the recruitment maneuver is in process. So here we have the total time it will last with all its phases. And also important is that we have a button in case a pressure drop occurs or the saturation of the patient occurs, in which the ventilator or the system will immediately return to the previous settings, so that we can immediately return to safe levels of pressure in order to avoid further complications in case they appear during the recruitment maneuver. Now we have reached the recruitment pressure, so the actual recruitment maneuver is starting now. We have reached 45 centimeters of water of inspiratory pressure and a PEEP level of 25. This means a delta pressure of 20. And this will be maintained now for 1.5 minutes. Now we need to pay special attention to the hemodynamic condition, because this is the moment of maximum stress on the respiratory system and on the cardiovascular system. So we need to make sure that we don't have any drops in blood pressure. We can also see that now during this phase the compliance tends to drop, because we are overextending the lung with these high inspiratory pressures. The recruitment maneuver is about to end, and then we will immediately start with the decremental PEEP trial. So it's important, when the time of the recruitment maneuver is fulfilled, is that the system immediately reduces the pressure to return to safe pressure values, and then we immediately minimize the stress on the lung and on the cardiovascular system. Now, after the reduction in pressure, the hemodynamics are recovering very fast. We didn't have a major drop in blood pressure, around 15 to 20 millimeters of mercury in total. The compliance immediately increases, and now we will start the decremental PEEP trial in order to find the closing pressure of the lung. So as we are reducing the PEEP sequentially, you see that the compliance is increasing. We are relieving the aortic distension with each reduction in pressure, searching for the maximum compliance, which indicates us the initial of the most dependent lung collapse. So now the compliance has started to decrease, and the system has been able to identify the maximum compliance, which was identified at a value of 47, and that corresponds to the PEEP level of 11. So now the system will recruit again with a stepwise increase in pressure, and again performing the same recruit maneuver, a little shorter in time, that was used in the previous, or in the first recruitment maneuver. So after identifying the point of maximum compliance, the closing pressure of the lung, the system shows us a comparative situation from before and after recruitment. We have the drying pressure on top, so we had a decrease in drying pressure of 4 centimeters of water. The compliance increased from 35 previously to performer in the recruitment maneuver to 49.7, so a major increase in compliance. This is why we have a reduction in the drying pressure. The PEEP level now recommended is 13 centimeters of water instead of the 8 centimeters of water she had before recruitment. Tidal volume was now different because we were using 5 mL per kilogram during the PEEP titration trial, and this makes a difference of 1 milliliter per kilogram predicted body weight in total. So now these are the recommendations. So the settings is a PEEP of 13 and a drying pressure of 6. So if you accept now, the system will readjust the alarm settings, and we accept this around the PEEP level. And now we see that we have returned to a ventilation and pressure control. We have a PEEP level of 13, the one that the system detected. And now we need to pay attention to the minute volume, because 6 centimeters of water drying pressure is probably too low. We would like to maintain a tidal volume of 6.57 mLs per body weight, so we can increase the level of pressure control to 9 in order to regain sufficient alveolar ventilation on a tidal volume. How this compass indicates us that we are ventilating the patient with lung protective settings. It is very important to apply a recruit maneuver in those patients that need the recruit maneuver, and those patients we need to evaluate the response, and it's essential to individualize the maneuver. And in this respect, the Auto SRM is a very nice tool helping us to do so.